We've been given the opportunity to be able to talk to someone, assess them properly, do a holistic assessment, identify where those gaps are in their care and what barriers they're experiencing that's stopping them from engaging in services. If we actually get to the reason why they're disengaged, we can actually have a huge impact in their well-being and their outcomes. It should be mandatory that this is part of people's care.
My first reaction to seeing a wellbeing nurse was, what's that for? I probably wouldn't have opened up as much, but all of a sudden one thing led to another and it was like, well, do you want me to ring them for you and find out what's going on? It's like, what do you mean? This is what a wellness nurse does. It's changed my life pretty much.
We do a little bit of hand-holding to provide them with steps forward. Part of that hand-holding is educating them so that once we finish up with the client, they've got the tools to continue their journey forward.
GPs have very little time to address some of the issues that people are presenting with, and often they are psychosocial issues. We can provide some of the services that they need, well, a lot of the services they need. Because of that, reduces the burden on the hospital system, but actually it reduces the burden on the GPs as well.
I didn't expect to end up being in a hub where it's like 5 or 6 people are sitting there in a meeting with you going, what can we do to best help?
It's been an amazing journey from our side, having that ability to sit within community health with an organisation that is really innovative and tries to move towards change that's needed, and so it's really exciting working in that way.
I've got this amazing story about a client. She had no money, she wasn't able to afford any of her medication, and she had no access to food. I did an immediate referral to the social worker, also referred her for counselling, referred her to a local community centre where they were providing food relief. Subsequent to all of that, we had a case conference last week. She was there. She was absolutely beaming, had got access to a healthcare card so she could afford her medication. She was being supported to be able to get Centrelink payments, which she hadn't been able to receive. She was having and engaged with counselling, and the counsellor was at the session as well. She was seeing the dietitian and the diabetes educator and had already seen the endocrinologist. The GP was also there at the case conference. She was now lining herself up to volunteer to help out with the food bank, and she was participating in the women's support group there as well. She said, I'm telling everybody about IPC Health and what they've done for me, because this is just incredible. She said, I've never had this type of service and support before.